One of the key components of helping people stop smoking is helping them use stop smoking medicines correctly. Now, there are a range of stop smoking medicines, all work by helping alleviate symptoms of withdrawal and making quitting easier. You need to be comfortable with explaining all stop smoking medicines. I know many of you will be able to provide nicotine replacement therapy to people, but you also need to include the 3 prescription medicines when you're talking to people about these medicines. I'm going to start off today talking about nicotine replacement therapy, and I'll try and demonstrate what I say to clients when I'm helping them stop smoking. The key thing to remember about these nicotine replacement products is they don't provide as much nicotine or as quickly as tobacco smoke, and therefore they're not as enjoyable. Many of these don't taste very nice to start off with either, and don't forget to reassure your clients they will get used to the taste over time. Also, make sure you reassure them about nicotine. Some clients will be a bit worried about using nicotine. They'll associate it with the health risks of smoking. But remember, it's not the nicotine that causes cancer or heart disease. That's the other stuff in tobacco smoke. Nicotine is what they're addicted to, and these products are going to help manage their withdrawal symptoms. So first, the nicotine patch. The nicotine patch provides some of the nicotine that the person would have otherwise got from their cigarette smoke, but not as much and much more slowly. The nicotine from the patch is released through the skin. It's enough to take the edge off withdrawal symptoms, making quitting easier. Now, I really advise that you show people how to use this. Getting it out of the packet is the first challenge, but then show them what to do with the patch by taking it off the back and applying it to a clean, dry area of skin, preferably hairless. Apply that patch down nice and firmly, and you leave it on the skin for 24 hours, except if you have got a pregnant woman you're helping to quit smoking, when it should be removed overnight. Now, reassure people that there's often a little bit of redness under the patch when they remove it. That is completely normal. It may also itch a little bit under the patch, or sometimes people notice an aching in their arm. And again, that's perfectly normal. It doesn't matter really where you apply the patch. It can be here, it could be on the arm or even your leg. Just make sure that it's stuck down well. You can swim, you can bathe with the patch on. The next product is the nicotine chewing gum. The chewing gum works by providing some of the nicotine that the smoker would have otherwise got from their cigarette smoke, but again, less rapidly and not as much. Many of your clients would have used nicotine chewing gum in the past, and many will complain of the taste. It's important to reassure people that yes, it doesn't taste very nice to start off with, but you can promise them they will get used to the taste over time. One of the problems with the gum is that people don't use it correctly. This is not like normal confectionery gum. You need to chew it, get a hot peppery taste, and then you stop chewing. You need to let it rest in the side of your mouth, between your cheek and your gums, to let the nicotine be absorbed across the lining of your mouth. It's absorbed across the lining of the mouth into the bloodstream, and that's how it has its effect. Swallowed nicotine doesn't really do any good, and in fact it might create a bit of heartburn or hiccups. So if any of your clients come back complaining of heartburn or hiccups, that's a sign to you just to check their technique. So again, they take a piece, chew it, get the hot peppery taste, stop chewing, park it in the side of their mouth and let it rest. When the taste starts to fade, give it another chew and park. Chew, park for around about half an hour. After that time, most of the nicotine has been absorbed. So your clients can spit it out, take a break, have something to eat and drink. This is about a day's supply. You should be encouraging people to use a piece every hour, especially initially in the early stages of the quit attempt. Later on, clients will know how much they need. Remember, the gum comes in 2 strengths, high and low. Your high strength product is for your more highly dependent smoker. And you can tell that easily by asking them, how soon after you wake up do you have your first cigarette? If they smoke within the first hour of waking, then they get the high dose product. If they smoke after an hour of waking, they can start on the lower dose product, but can always go up if they need to. Get people to use this regularly and take as much as they need to keep the withdrawal symptoms at bay. Next product is the nicotine lozenge. like the gum, this product doesn't taste very nice to start off with. But it is a medicine, and people will get used to the taste over time. This, like all the other nicotine replacement products, provides some of the nicotine that they would have otherwise got from their cigarette smoke. Enough to take the edge off withdrawal symptoms, making quitting easier. Clients can roll this around in their mouth, let it rest. The nicotine's absorbed across the lining of the mouth. And after about half an hour, the lozenge should be dissolved. If not, they can keep sucking it for a bit longer. But take a break between each lozenge and try and get them to use it regularly. Again, a blister pack is around about a day's supply. Trying to get people to use it regularly, one every hour. It won't taste very nice to start off with, but you can promise them they'll get used to the taste over time. Now, currently, the nicotine patch, gum and lozenge are the 3 subsidised products. So you'll be able to provide these directly to your clients. You can also combine products. In fact, the evidence shows us that combination nicotine replacement therapy is more effective than single product. So you should recommend that people use patch and lozenge or patch and gum. That's going to give them the best chance of success. These are safe for smokers to use. They've been used to large quantities of nicotine for a very long time, but do keep them out of the reach of children. Now, there are some other nicotine replacement products that you can get at supermarkets or pharmacies, but clients have to buy these themselves. Do your homework. Find out which place sells the products cheapest. Often it's supermarkets. This is the nicotine inhalator. Now, this is a product you can buy over the counter in pharmacies or supermarkets, and it too provides some of the nicotine that the smoker would have otherwise got from their cigarette smoke. Now, this product, despite its name, does not give you inhaled nicotine. That's why it's called the nicotine inhalator. The nicotine delivered by this product is absorbed from the lining of the mouth. Now, it consists of this tube. There are 2 ridges on top which you need to align to be able to pull it apart. And this gives you a capsule which has a nicotine-soaked sponge in it. When you put the capsule into the device and you break the seals, you're able to inhale directly on this. So the product comes with 4 capsules. That is a day's supply, and you should encourage your clients to get through all 4 capsules. They need to puff on this for about 20 minutes every hour. I know that sounds like quite a lot, but to be effective, this needs to be used regularly. In the winter months, keep it warm. That's going to help the nicotine be released a little bit easier. This too can be used in combination with the nicotine patch. What some people really like about this is it replaces some of the behaviour of smoking. It's not a perfect replacement, but some people really enjoy it. This is the nicotine mouth spray. This is the fastest acting nicotine replacement product that we currently have. You can buy this in the supermarket or pharmacies. I'd advise you that when your clients buy this, tell them to save using it until they come and see you, because it does involve a little bit of a specific technique. The first thing you need to know is how to open it. It has a child-proof cap on it. You need to depress the lever at the back, and this raises a spray. On first use, you need to prime this device. So we need to give it a few squirts to get a nice mist. You don't want to be squirting a jet of nicotine solution into your mouth, because you'll end up swallowing it and you will get hiccups from it. So the idea is that you're going to get a nice good spray aiming it at the side of your cheek. Now, for many clients, they're going to need to almost put this in their mouth to get the side of the cheek. It's nice and easy to use once you get the hang of it, but it's 1 spray each cheek each hour. This has a slightly hot peppery taste as well. Good technique when you're talking to clients is get them to swallow first. Empty the saliva out of their mouth, then spray, and let it rest for a minute. That gives some time for the nicotine to be absorbed. The most common side effect with this medicine is hiccups. So if people come back complaining of hiccups, you know you just need to help them improve their technique. This too can be used in combination with the nicotine patch. There are a couple of other products that you can get. One is a small lozenge. This works very much like the larger lozenge I showed you before, but you can see that it is much smaller. This too works by providing some of the nicotine that you would have otherwise got from cigarette smoke, making quitting easier. It is a bit hot and peppery, like the other oral products, but people will get used to it over time. Aim to use about one of these little lozenges every hour. Using it regularly is going to give you the best chance of success. There are some products that aren't available in New Zealand yet, and I just want to mention one. This is only available in Australia so far. This is the nicotine mouth strip. Now the nicotine mouth strip again works by providing some of the nicotine that you would have otherwise got from cigarette smoke. They can be a little bit difficult to open, so practice and help your clients get the hang of this to start with. This is what it looks like. It's like one of those Listerine breath strips. Very easy to use. You pop it on your tongue, you lift your tongue up to the top of your mouth, and this is where it sticks. It releases the nicotine across the lining of your mouth, helps make quitting easier by reducing the severity of tobacco withdrawal symptoms. Again, you'd want clients to use this regularly, especially in the first few weeks of the quit attempt. There are no doubt going to be more nicotine replacement products as time goes on. But currently, the three that are subsidised are patch, gum and lozenge, but there are other products that people can get hold of, and it's your job to help give them some good information about all of these stop smoking medicines. So just to recap, remember to give some clear, simple messages. Try and address those unrealistic expectations that people might have about these products. All NRT products work by providing some of the nicotine that they would have otherwise got from their cigarette smoke. Not as quickly and not as much, so they're not as enjoyable as smoking. But they're enough to take the edge off withdrawal symptoms, making quitting easier. Your client is still going to have to put in some work, and certainly some of those behaviour change techniques that you use will help lessen withdrawal symptoms. Medicines are just part of the solution.